Okay, for removing fecal impaction digitally, you identify the patient at least with two identifiers, like their name or birthday. You ask them about their BM uh, patterns, if it's frequent, if it's hard stool, loose stool, if they use any enemas or laxatives, if they have the urge to defecate but they can't do so, or they're feeling incompetence emptying, bloating, cramping, things like that. You inspect the patient's abdomen for any distension. You auscultate all four quadrants of the abdomen for bowel signs. You palpitate for distension, discomfort, any masses. You ask them for their pain scale if they have any in their stomach area from 0 to 10, 10 being the worst. You take a current vital signs for them as well. If they have a spine injury, you review his or her routine for digital removal. Perform hand hygiene. Observe their consistency of stool. Determine if the patient's on anticoagulants like aspirin or heparin or anything, because you don't want them to bleed. And you check their health records if they have any orders as well. And then when you're done with your assessment, you ask them if it's okay for you to actually do the procedure. You take off your gloves and get your hand washing items like hand sanitizer, clean your hands, and arrange your materials. You have a drape. You drape it on the patient's lower trunk area right there. Help them with the blankets and place a pad underneath the resident's rear end right here to make sure you don't mess up their sheets. You get some lubrication with maybe some anesthetic if the doctor orders it, gloves, and a trash bin or a bedpan. First, you have the bed in the working height for you with your hips level. You apply your gloves after you wash your hands. You have the patient go over to their side, lift their knee up a little bit. You apply your gloves on. You lubricate your dominant hand, the index finger, the middle finger. Instruct the patient to take slow, deep breaths during this procedure, and you gradually insert the gloved index finger into the anus until you feel it relax around your finger. Then you insert the middle finger, and you wait for the same as well. And then, if the patient is tolerating it okay, you advance it towards the rectum wall, towards the umbilicus, gently loosening the fecal mass by moving fingers in the scissor-like motion to fragment the fecal mass, working your fingers into the harder mass. You do this in intervals as long as the patient can tolerate it, and let the patient rest through this whole procedure. When you're breaking down the fecal mass into fragments, you work it down towards the end of the rectum, removing small sections of feces and discarding it into the bedpan. Then you observe the patient response, assess the heart rate, look for signs of fatigue, make sure the patient's doing okay, take breaks. After removal of impaction, perform perianal hygiene, remove the bedpan, inspect feces for color and consistency, dispose of the feces in the toilet. If needed, help the patient into the toilet and clean and store the bedpan. Remove gloves and turn them inside out, discarding in a proper area.